Questions for oral answer. Question number 1, in the name of the Honourable Annette King.
Thank you, Mr Speaker. My question to the Minister of Health. Does he stand by his statement that, quote, we've slowed the growth of public spending, end quote, given growth in health spending has slowed from over 9% under Labor to just 2.6% over the last 5 years? And what impact has this had on district health boards?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes. If we had maintained the rates of growth in public spending that we'd inherited from Labor, New Zealand would owe $100 billion more in debt by 2021, and the debt to GDP ratio would grow to 60% rather than the 30% we have reduced it to. While health expenditure has grown by $4 billion, we focused on the quality of spending, with DHBs delivering more services to Kiwis than ever before.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. If an increase of 2.6% is okay by him, how does he explain the insufficient funding being given to Canterbury DHB for mental health services to cope with an increasing number of cases of people suffering mental trauma arising from the earthquakes?
The Honourable Dr Jonathan Coleman.
Mr Speaker, there is not insufficient funding. I was down in Canterbury at the start of November. I announced an injection of an extra $13 million to that DHB, part of which would be used for mental health services at the discretion of the CEO. So that member might run her political argument, but it's not the truth.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Is he denying that he has been told that Canterbury DHB mental health figures show that child and youth cases are up 67%, rural adult cases up 80%, and adult psychiatric assessments at EDs are up 102% since 2012, increases that are way out of line with other DHBs?
The Honourable Dr Jonathan Coleman.
I'd have to check those figures, but I can tell the member I was meeting with the Mayor of Christchurch this morning. I was down in Canterbury last week making an announcement. The fact is, obviously, there's been unusual pressures in Canterbury over the last 5 years, and the government has supported the people of Canterbury with an extra $70 million on top of the extra $254 million that's gone in over the last 7 years, and it's up to the CE to make sure that he provides the services that the people of Canterbury need within that budget.
Supplementary question, the Honourable Annette King.
Well, in light of some people recognising demand and circumstances in Canterbury, why is mental health funding at Canterbury DHB significantly below the national average for mental health services, as highlighted by the CE at the Select Committee yesterday?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I'd absolutely dispute that. The fact is mental health funding is ring-fenced. There have been extra injections of funding into Canterbury, an extra $70 million. We've also had special programs to actually promote awareness around mental health issues down there. More and more money has gone into Canterbury, an extra $254 million over 7 years. It's a huge budget, and the CE has to make decisions at his discretion to provide the services that people down there need. It's a far cry from when Annette King injected another $3 billion but delivered less.
Order.
I just wonder whether you could give a ruling later whether we're going to this year have the Minister at the end of his questions bring up the fact I was a Minister 11 years ago in all his answers to justify his own inadequacy.
Order. The member makes a good point, and the last part of the answer from the Minister was not going to help the order of the House. But on this occasion, I was possibly more lenient than normal in that in the very primary question, the member asking the question has actually taken the opportunity to bring in the previous government's record into the question. So I think that gives a little more leeway to the Minister, but I would also be grateful. I would also be grateful if the Minister could refrain from normally towards the end of his question putting in a flick at a previous Health Minister. Further supplementaries, the Honourable Annette.
Speaker. Sorry, Paula, what's up?
Order.
What's up?
Order. I'm not going to put up with that amount of interjection coming from my right-hand side. Supplementary question to be asked by the member, otherwise we'll move on.
No, I've got one.
Supplementary question, the Honourable Annette King.
Supplementary question. Why did the government turn a blind eye to the request for an additional $4.1 million for mental health services in Canterbury 2 years ago? And even as recently as 2 months ago, the Director-General was told by the DHB, quote, there is an increased demand, particularly for women, for children, youth and new entrants to school who are demonstrating developmental delay and parental distress.
The Honourable Dr Jonathan.
Well, that's absolutely incorrect. I mean, I was down there in November announcing the extra $13 million, and that is more than ample to cover the $4 million that Canterbury said was necessary to cover mental health demand. So you've got to get your facts straight.
Supplementary question, Mr.
Supplementary
Speaker.
question, the Honourable Annette King.
Why is the Minister not aware that in fact the $16 million he gave to the DHB was not for mental health services, but was in fact for deficit support, not for additional mental health services? I would have thought he would have known that.
Order. The question's been asked. The Honourable
No,
Dr
Mr.
Jonathan.
Speaker, that's totally incorrect. That's money which the CE can use at his discretion to fund the services that the people of Canterbury need. That's the facts.
I've got the facts right. I was at the Select Committee.
Supplementary question, the Honourable Annette King.
Why is the Ministry of Health not passing on information to the DHB about detainees arriving from Australia with mental health problems who are adding to the burden for an underfunded mental health services in that region?
The Honourable Dr Jonathan Coleman.
Look, all that bluster sounds like a great conspiracy, but in actual fact there's very clear lines of communication between the Ministry and Canterbury DHB, and to suggest otherwise is totally mischievous. You know that.
What I do know, point of order, Mr. Speaker.
Point of order.
I seek leave to table a 26th of January this year Hospital Advisory Committee meeting report saying the Ministry is not passing the...
Order. In tabling documents, a member's required to nominate what the document is, give us the date, which in both cases is done, but it's not an opportunity to then detail the contents. I will now put the leave and the House will decide. Point of order, the Honourable...
Mr. Speaker, you must surely want a little bit of an idea about what it's about. It could be about any old thing.
I've got enough of an idea, and it's actually more for my information as to whether I put the leave. The House will decide whether it wants the information. But as we had yesterday on one occasion, the tabling of documents is not an opportunity to make political points. It's about informing members. Members have enough information, I'm sure, from what's been given. It doesn't need to be described further. I will put the leave, the House will decide. Leave is sought to table that particular medical information dated 21 January. Is there any objection to it being tabled? There is not. It can be tabled. Point of order, the Honourable...
Mr. Speaker, once again, I would like you to consider this, because the reason why I wanted to table it, if you listen, the Minister disputed that I was telling the truth.
Order. 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 I've put the leave. The document will be tabled. That's the end of the matter. Does the member have further supplementaries? Then, question number 2, Dr Parmjeet Palmer.
Thank you, Mr.